Hi folks, I'm Dr. Ed Beyer of Beyer Natural Health Solutions in Tinley Park, Illinois. You know, I've been in practice for 33 years, and what I practice is called functional medicine. I am interested in what you have, but I'm more interested in why you have it. And one of the topics that I really want to share with you today is really near and dear to my heart because so many people have it and so many people are doing things for it that actually make problems worse. And that is acid reflux and GERD, gastroesophageal reflux disease. Now, I want to explain a little bit about the physiology. I'll try not to be too boring, but you need to understand some of the physiology in order to understand what causes this. Now, the stomach absorption means bringing things from in the gut into the bloodstream. And the stomach is where things start to happen. The stomach by nature is very, very acidic. In fact, if you put your finger into a healthy stomach after someone ate, that finger would be down to the bone in 30 seconds. The pH of the stomach is actually a pH of 2, which is super acidic. It's 100,000 times more acidic than water. Why does the stomach work like this? Number one, it breaks down our food. So when food goes into the stomach, it has to be broken down immediately. Every mouthful of food that we have has germs in it, microbes that don't belong in our body, so the stomach acidity is there to kill those germs. And the third reason, which gets a little complicated, is when the food leaves the stomach to go into the small intestine to be absorbed, you need to stimulate the pancreas and the gallbladder. If the stomach acidity is not sufficient, you will not stimulate pancreatic function and gallbladder, which we're going to get to in a little bit. So poor stomach acids, what they will do is when the food leaves the stomach, it's going to stimulate the pancreas to release digestive enzymes, amylase, proteases, lipases, to further break down our food to a microscopic level in the small intestine so it can make its way through the microscopic holes in our intestine so it can go into the bloodstream. But also what happens is the pancreas will release sodium bicarbonate only if the stomach acid is sufficient. And the reason why is because we want the food to be acidic when it leaves the stomach, but we don't want it acidic the rest of the way through the bowel. So we release or the pancreas releases sodium bicarbonate, which neutralizes the acidic food, and it actually makes it a little bit alkaline. So what we see is if the stomach is not sufficiently acidic, then we don't get that release of sodium bicarbonate, and the food stays too acidic throughout the bowel, and the body becomes too acidic. So not enough acidity in the stomach creates a scenario where the body becomes too acidic. It's an inverse relationship. So the gallbladder is the same way. The gallbladder, it only will work if the food exiting the stomach is acidic enough. The gallbladder releases bile salts only if the stomach contains enough acid. And the bile salts we're going to get to in a little bit. So the symptoms of poor pancreatic function due to low stomach acidity, which is known as hypo or low chlorhydria, is you will not digest your fibers. We'll see indigestion or fullness even 2 to 4 hours after eating. You'll get pain underneath the left rib cage, excessive gas, undigested food in the stool, and the stool can be greasy, foul-smelling, and poorly formed. And then some of the symptoms we'll see when the pancreas isn't being stimulated enough by the food not being acidic enough leaving the stomach. Greasy and high-fat foods cause distress. You eat something that's a little bit fatty, like a steak or whatever, and that bothers you. Lower bowel gas and bloating several hours after eating, a metallic taste in the mouth. This is a classic one. Burping up fishy taste after consuming fish oils. Like if you eat a fish or you take supplements in fish oils, you burp it up. That is a sign that the gallbladder is not being stimulated. Now the gallbladder is very important in fatty acid metabolism, so the skin is very dependent upon that. So we see itchy, dry, flaky skin or scalp. People will put salves and lotions on their skin, but if the gallbladder is not working, or if you don't have a gallbladder, you're not absorbing those fats for the skin. Reddened skin, especially in the palms, a history of gallbladder attacks, or even stones, or even having the gallbladder removed. So if you've had your gallbladder removed, you really need to be taking bile salts. And hormone imbalances, because the gallbladder, we need a proper functioning gallbladder to remove our steroid hormones and our sex hormones so that we have proper balance. So when the stomach is not acidic enough, the rest of the gut and body become too acidic. And I've already explained why, because you're not getting that release of sodium bicarbonate from the pancreas. You need a pH of 2 in the stomach to release the pancreas enzymes and the sodium bicarb and the gallbladder. If the stomach acidity is at a 5, it's still acidic, that won't trigger the pancreas to release sodium bicarb nor the enzymes and bile salts from the gallbladder. And we see all this dysfunction. The pH of the gut changes. And just like a pool, if the pH of a pool is off, you're going to get things growing too much or things not growing, and it creates problems in the gut. So what happens when this hypochlorhydria, it leads to leaky gut syndrome, which is an increased intestinal permeability. I compare it to like having little holes in your screen door on a hot summer day. Things start to make their way into the bloodstream that don't belong. And now the immune system doesn't like that. They're going to start attacking these larger than normal molecules. And that is going to create inflammation throughout the body, achy joints, skin irritation. And then these chemicals of inflammation go across the blood-brain barrier, and they create all kinds of brain inflammation, brain fog, and things like that. So we see joint pain. And inflammation really is the underlying cause of heart disease, brain fog, skin issues, and even problems in the lungs, people that constantly have to cough up phlegm. We're going to start to see the immune system attacking food because you're getting larger than normal food particles making their way into the bloodstream, and now you're going to have an immune reaction to it. It's the biggest trigger to autoimmune disease, because when you got things leaking into the body, into the bloodstream that don't belong, the immune system's so active trying to get rid of them, it starts to make mistakes and it starts to attack your own tissue. So that's the biggest trigger to autoimmune disease, and then you're going to get further breakdown of the gut. So because of the pH changes, because of the low stomach acidity, we're going to get pH changes in the gut. Bad bacteria readily grow in this acidic environment. And so what happens is when you eat your fiber, now you got these overgrowths, you're going to get over-fermentation of the fiber. And when you over-ferment the fiber, now you're going to produce extra gas. Every time something's fermented, there's gas release. And that's a normal process, but if there's too much, you're going to get an excessive amount of methane gas, which is going to cause constipation. And if you get an excessive amount of hydrogen gas, that causes diarrhea. This is the ultimate scenario of irritable bowel syndrome. So controlling stomach acidity is very important for irritable bowel syndrome. Now, low stomach acidity and poor gallbladder function. Now, the gallbladder, its job is to emulsify fats so that we can absorb them. If you put oil on water, it's just going to sit there, right? You need an emulsifying agent. That's what bile salts do from the gallbladder. So if you get a decreased flow of bile salts because it's not being stimulated due to the low stomach acidity, you're going to get a decreased absorption of the fat-soluble vitamins, vitamin A, D, E, and K. I see so many patients, I see a vitamin D deficiency on their blood work. They're like, Dr. Beyer, how can that be? I'm taking vitamin D every day, because they're not absorbing it. And then you don't absorb your fatty acids, and that causes a lot of chronic illnesses, and that's a topic for another video. Then we're going to see a lack of ability to remove fat-soluble toxins, especially hormones. Hormones come from cholesterol. They're fat-soluble. We make them, we use them, and then they got to be removed. If the gallbladder is not being stimulated due to low stomach acidity, we get hormone imbalances, especially estrogens in females, high cholesterol, chronic illness, and liver dysfunction. So low stomach acidity leads to your food sitting in your stomach too long. Now follow with me, because a lot of people don't understand this, and most doctors don't understand this. When you don't have enough acid in your stomach, your food sits there too long. It doesn't break down. Everybody understands that. So what are you going to feel? Bloating right after you eat. Now you got so much pressure in your stomach because the food's not being broken down. The little bit of acid that you have gets refluxed up into the esophagus. So you have too much acid here because you got too little acid here. Acid reflux is almost always due to too little acid. Now the food's going to sit there too long in the stomach, and it's going to erode the stomach lining, and that causes ulcers. Now you don't have enough acid. Every time you eat, there's germs in your food. You're going to get infections, and it leads to poor absorption. And the medical solution to this, it's actually maddening. They're going to put you on acid reducers, things like Nexium, Prilosec, omeprazole, pantoprazole. These are proton pump inhibitors. This lowers the acidity. Here's where it's deceiving. It makes you feel better here, but at what cost? It actually decreases the acid in your stomach. So it gives you symptomatic relief, but it causes severe malabsorption, which leads to osteoporosis, fatigue, chronic illness, nutritional deficiencies. It leads to gut infections, which causes more inflammation. The most common is H. pylori or Helicobacter pylori. It breaks down the gut barrier. Now you got this chronic inflammatory situation and autoimmune triggers. It leads to overgrowth in the small intestine bacterial overgrowth, which leads to IBS, constipation, diarrhea, and fatigue. Do you know these proton pump inhibitors, these Nexium, Prilosec, omeprazole, pantoprazole, you're only supposed to be on it 14 days every 4 months. And most doctors don't tell you that. So people that come to me and they're on these medications, we address the underlying causes to the lack of acidity and why they're refluxing, and they can get off these medications without symptoms in about 4 to 6 weeks. Now, the causes of low stomach and acidity, which leads to GERD or acid reflux: poor brain-gut connection. The autonomic nervous system, there's a nerve in our brainstem called the vagus nerve, which comes down and tells our stomach to make acid. So many people don't have that area of the brain working. When I examine them, we look at palatal elevation. We make them say, ah, 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 and if the palate doesn't elevate, we know that nerve's not working. Or we check the gag reflex. If you gag too easily or you don't gag at all, that means that nerve isn't firing. So we give this patient neurological exercises to do to stimulate that area of the brain. Inflammatory foods and food sensitivities will lower our ability to produce acid in the stomach, so we do testing to figure out what foods is the patient eating that's creating this. Taking Nexium, Prilosec, omeprazole, pantoprazole, folks, these are the most dangerous medications that you can take for your health. If you're on them long term, if you don't go to me, go to someone like me that can get you off them. Thyroid is a major player when it comes to the ability to make acid in your stomach. Zinc is very important to be able to make acid in your stomach, and having chronic H. pylori infections will also lower our ability to make stomach acids. So in our world, from functional medicine, we do proper testing to identify the true underlying causes to low stomach acidity and GERD, and we can get you off the medication and get you healthy. If you like what you hear and you want to see more videos, please like and subscribe. If you know someone that's suffering from GERD or acid reflux, please share this with them. I'm Dr. Ed Beyer. Enjoy the rest of your day.